Welcome to Modern Group of Institution. Today in Pharmacology second, BP503T, we study about congestive heart failure. The contents of today's lecture is definition of congestive heart failure or heart failure, type of congestive heart failure or heart failure, etiology, that is the cause, epidemiology, that is the spread of congestive heart failure, risk factor, pathophysiology, signs and symptoms, complications, and diagnosis. Basically, what is congestive heart failure or heart failure? Sometimes it is also referred as chronic heart failure. What is congestive heart failure? It is a complex clinical syndrome that can result from structural or functional cardiac disorder that impairs the ability of ventricle to fill or eject the blood. Basically, what happened in our heart, the ventricle is unable to fill or eject the proper amount of blood which is required by the body. Congestive heart failure is also described as a condition where the muscles of the ventricles becomes weakened and cannot pump the blood strongly as in normal heart condition, which leads to less oxygen reaching to the organs and muscle, which can make the feel tired and shortness of breath. Congestive heart failure is also refers to a state in which abnormal circulatory congestions exist as a result of heart failure. Now, if we talk about the type of heart failure, first if we talk, it is low output heart failure, it is due to systolic heart failure. The symptoms include decreased cardiac output, decreased ventricular ejection fraction. Now, diastolic heart failure, elevated left and right ventricular and diastolic pressure, increase in the left and right ventricular and diastolic pressure occurs, and normal left ventricular ejection fraction. Now, if we talk about the high output heart failure, in high output heart failure, peripheral shunting, low systemic vascular resistance, hyperthyroidism, beriberi, carotenoid anemia, these are the symptoms which are produced by the high output heart failure, and it may have normal cardiac output. And then we talk about the right ventricular failure. It is mainly seen in the pulmonary hypertension because the right ventricle mainly supply blood to the pulmonary artery to the lungs. So it causes pulmonary hypertension. Now, if we talk about the etiology or the cause, मेजर क्या कारण है कंजेस्टिव हार्ट फेलियर होने की? जो सबसे बेसिक मेजर cause है, etiology है behind the congestive heart failure is hypertension in 75% of the cases. And the second cause is structural heart change, जैसे कि valvular dysfunction, जो कि किससे कॉज हुआ? प्रेशर या वॉल्यूम ऑफ ब्लड ओवरलोड हुआ हार्ट के ऊपर, जिसके कारण से हार्ट हमारा प्रॉपर अमाउंट में ऑक्सीजन की जो रिक्वायरमेंट है हार्ट की सेल्स को नहीं मिलती है, हार्ट की मसल्स को नहीं मिलती है, जिसके कारण से कंजाइनेटल हार्ट डिफेक्ट्स, सीवियर लंग डिजीज, leads to diabetes, severe anemia or overactive thyroid gland, abnormal heart rhythms. Sometimes increase in the pulmonary pressure result in the fluid in the alveoli, accumulation of the fluid in the alveoli, which lead to the pulmonary edema. Sometimes systemic pressure increase cause result in the accumulation of the fluid in the tissue. It is called peripheral edema. Health condition, either damage of the heart or overworking of heart, leads to congestive heart failure. Coronary artery disease may also be one of the cause of congestive heart failure. Heart muscle disease like cardiomyopathy and heart inflammation, myocarditis, that is inflammation of the myocardial cells, may lead to congestive heart failure. Now, if we talk about the epidemiology, means how the condition of Indian people in congestive heart failure. 7 million Indian people have congestive heart failure in 2019. Every year 5,50,000 new cases are coming, and 8 lakh patients with congestive heart failure hospitalized every year. 2,50,000 die every year with the congestive heart failure. 50% of patients die within 5 years. 150% increased in last 20 years. As you see the data of epidemiology of congestive heart failure. 2.6% total population has this disease, and incidence and associated morbidity and mortality is expected to increase in future. As day by day, the fooding habits and the exercising habit are changing, the congestive heart failure is spreading his leg into the Indian people. What are the risk factors? The risk factors are hypotension due to the hypotension, fluid retention, worsening of congestive heart failure, bradycardia or heart block, contraindication in the patients with congestive heart failure exacerbation. Now, coming to the pathophysiology of the congestive heart failure, in order to maintain normal cardiac output, various compensatory mechanism plays an important role in the congestive heart failure. First, the tachycardia is the activation of the neurohormonal system due to the release of norepinephrine and ANP, arterial natriuretic peptide, and activation of renin, angiotensin, aldosterone system. This all system increase the blood pressure, and due to the rise in the blood pressure, the patient leads to congestive heart failure. Now, in the pathophysiology, if we talk about the Starling law, within the limits, the force of ventricular contraction is the function of and diastolic length of cardiac muscle. If we closely relate the ventricular and diastolic volume with the muscle, if increase in the length of the sarcomere, dilation of the heart increases. Increase in the myocardial contractility thereby maintains the stroke volume and leads to heart failure, result in the depression of ventricular dysfunction. जो हमारे हार्ट की मसल्स हैं, उन मसल्स का अगर मायोकार्डियल फाइबर की लेंथ अगर इंक्रीज होती है, लीड्स टू हार्ट फेलियर, रिजल्ट इन डिप्रेशन ऑफ वेंट्रिकुलर फंक्शन. कंपनसेशन हम कैसे कर सकते हैं? स्ट्रेचनिंग ऑफ मायोकार्डियल फाइबर. Stretching of myocardial fiber leads to cardiac dilation, occurs in the left ventricle and fail to eject normal and diastolic volume. What are the basic mechanism behind the congestive heart failure? Overactivation of the sympathetic nervous system, overactivation of the renin-angiotensin system, and myocardial hypertrophy and altered cardiac rhythm. Now, if we talk about left ventricular failure and right ventricular failure, left ventricular failure is due to ischemic heart disease, myocarditis, valvular heart disease, and restrictive pericarditis. Now, if we talk about right ventricular failure, cor pulmonale, right-sided valvular disease, right-sided myocardial disease, and pulmonary hypertension. This all lead to activation of norepinephrine or ANP, which leads to tachycardia and further stress on myocardium, which leads to congestive heart failure. Sometimes it also activates renin angiotensin aldosterone system. Renin angiotensin aldosterone system increase the sodium and water retention, which leads to further stress on myocardium cells and which form congestive heart failure. Due to this, myocardial contractility increase, cardiac workload increase, cell stretching increase, and compensatory hypertrophy and dilation of the ventricle. Now, if we deeply talk about the renin-angiotensin system, renin and angiotensinogen produce angiotensin 1 and angiotensin 1 by angiotensin converting enzyme convert angiotensin 1 into angiotensin 2, which is an potent vasoconstrictor. This potent vasoconstrictor, what it do? It increase the aldosterone secretion, which cause salt and water retention. Salt and water retention, plasma volume increase. Plasma volume increase, preload in the heart increase, cardiac workload increase, and which cause heart failure and congestive heart failure. Angiotensin 2 also a potent peripheral vasoconstrictor. It constricts the blood vessel, decrease the cardiac output, and leads to heart failure. If we see the ventricular remodeling, वेंट्रिकल्स में क्या चेंजेस आते हैं, क्या मॉडिफिकेशन होते हैं, अगर हम लेफ्ट फर्स्ट डायग्राम के अंदर अगर हम देखें, लेफ्ट वेंट्रिकुलर हाइपोट्रोफी इन विच बेसिकली व्हाट हैपन, जो लेफ्ट वेंट्रिकल है हमारा, लेफ्ट वेंट्रिकल की मायोकार्डियल सेल्स जो है, मायोकार्डियल सेल की लेयर की थिकनिंग इंक्रीज हो गई है, जिसके कारण से हमारा लेफ्ट वेंट्रिकल हाइपोट्रोफी हो रहा है। सेकेंड जो हमारा डायग्राम है, सेकेंड डायग्राम में हमारा क्या हो रहा है, इन द सेकेंड डायग्राम स्वेलिंग ऑफ द लेफ्ट वेंट्रिकल ड्यू टू मायोकार्डियल सेल की ओवर एक्टिविटी के कारण से क्या हो रहा है, हमारी जो वेंट्रिकल्स है, वेंट्रिकल्स के जो सेल्स हैं वो क्या हो रहे हैं, डायलेट हो रहे हैं, और हमारे वेंट्रिकल का साइज इंक्रीज हो रहा है, वो स्वेल हो रहा है। Next, what are the signs and symptoms of the congestive heart failure? First symptom is shortness of breath. आपको सांस लेने में तकलीफ होगी जब एक्टिविटी हम करेंगे, समटाइम्स जब हम सो रहे हैं या लेट रहे हैं while lying flat. वीकनेस होगी बहुत जल्दी, मसल फटिगनेस, और जैसे ही हम उठ के बैठेंगे उस टाइम पे शॉर्टनेस ऑफ ब्रेथ एट नाइट, पिलोज की नीड्स हमको बढ़ जाएगी क्योंकि लंग्स चाहेंगे एक्सेस फ्लूइड को ड्रेन करना, कफिंग, स्नीजिंग, स्वेलिंग इन द फेट एंड एनोरेक्सिया, भूख नहीं लगेगी आपको, एंड वेट गेन. दीज आर द साइंस एंड सिम्टम्स. Second signs and symptoms in heart, it causes cardiac arrhythmias, hypotension. If we talk about GI, it causes vomiting, diarrhea, abdominal pain, constipation. If we talk about signs and symptoms of neurological, it causes headache, fatigue, insomnia, vertigo. In visual, it causes color vision and colored halos around the subject. Miscellaneous signs and symptoms of congestive heart failure are allergic, thrombocytopenia, and necrosis of the cell. In heart, it also causes SA node and AV node suppression, AV node block, arterial arrhythmia, and ventricular arrhythmia. Now, how to diagnose the congestive heart failure? The congestive heart failure mainly diagnosed with the help of electrocardiogram, chest X-ray, electrocardiography, that is known as echocardiography, heart catheterization, a camera is involved in that, stress test, it is also known as TMT, and blood test. So that's all for the congestive heart failure. Thank you very much.